Welcome to The Explainer. So today we're going to talk about something pretty amazing, the secret architectural story behind your smile. Yeah, we're talking about how your teeth are literally built right from the ground up. I mean, really think about it like that. What if a smile was built just like a house? You've got a blueprint, right? You've got specific building materials, a construction schedule, and yeah, even a move-in day. And understanding this whole process, well, it's not just cool trivia. It actually explains why our teeth look the way they do and, what happens when those construction plans go just a little bit sideways. So let's start at the very beginning. This is where it all gets decided. Long before you can see a single tooth, there's this incredibly complex set of instructions being laid down. This is the blueprint phase, and it dictates literally everything that's about to happen. All right, so this whole construction project happens in 6 main stages. First up is initiation. Think of this like getting the zoning permit. It decides exactly how many teeth are going to be built. Then we move into the bud, cap, and bell stages. This is where the basic shape starts to form, kind of like putting up the framing of the house. After that, we've got apposition. This is where the hard stuff, the enamel and dentin, are layered on. It's like putting up the drywall on the siding. And finally, the big moment, eruption. That's move-in day, the grand opening.
And here's what's so cool about thinking of it this way. It explains everything. If there's an error right at the beginning, in that blueprint stage, well, you might end up with too many or too few teeth. Makes sense, right? If something goes wrong during the framing, the shape of the tooth might be off. And a glitch during that final layering stage, yep, that's going to affect the quality and the strength of the tooth itself. So the timing of the problem tells you exactly what kind of defect you're gonna see. It's so logical.
Okay, so every good construction site needs specialized crews, right? Same thing here. There are 3 main teams or tissues doing the work. You've got the enamel organ. That's the crew that builds the hard outer shell, the enamel. Then there's the dental papilla, and their job is to build the inner core, the dentin and the living pulp. And finally, you have the dental follicle. They're the ones building the foundation, all the stuff that holds the tooth securely in your jaw. All right, so let's see how this all plays out with the first occupants to move in, the baby teeth. Now, I know we all think of them as just temporary, but trust me, they are so important and have a massive job to do. And here's something you might not know. Baby teeth are not just mini adult teeth. Nope, they're built completely differently. Look here. They've got thinner enamel and dentin, and their pulp chambers, that's the little room inside where the nerve lives, are way bigger. So what does that mean in the real world? It means cavities can get to the nerve much faster in a kid's tooth. That's why catching them early is absolutely crucial. Okay, now for what is maybe the most dynamic, craziest phase of all, the big transition. This is so much more than just teeth falling out and new ones showing up. It's honestly a masterclass in space management as the jaw gets ready for the permanent residents to move in. And get this, nature actually gives us this clever little gift to help make it all work. It's called leeway space. So the last 2 baby molars, they're actually wider than the adult teeth that are going to replace them. So when they fall out, they leave behind this little bit of bonus space. It's like a natural space saver that the mouth can use to get everything lined up just right. How cool is that? So you might be wondering, how do those first big adult molars know where on Earth to go? Well, they have a guide. It's called the terminal plane. Just think of it as the way the back surfaces of the very last baby molars line up. That alignment acts just like a traffic cop, directing that brand new adult molar right into its proper spot. Now, if a kid has what's called a flush or a mesial step plane, that is fantastic news. It's basically a green light. These alignments create the perfect path for the adult teeth to come in and form a really healthy, stable bite, what dentists often call a class 1 relationship. But if a dentist sees a distal step, well, that's kind of like a yellow flag. It guides that adult molar into a spot that really increases the chances of a future overbite. Now, it doesn't guarantee there's going to be a problem, but it's a huge early warning sign that tells the dentist, hey, we need to keep a really close eye on how this develops. Of course, just like any big construction project, things don't always go perfectly according to the blueprint. Sometimes you get glitches in the system. These are the developmental anomalies that dentists are always on the lookout for. So here's a classic dental mystery for you. A kid's upper front tooth just isn't coming in. Weeks go by, nothing. So what's the #1 culprit? You might be surprised. It's often something called a mesiodens. It's an extra hidden tooth that's grown right smack in the middle and is literally blocking the path. It is the #1 reason for this very specific problem. Okay, now check this out. This is a real head scratcher. You look in the mouth and you see one single, really big tooth. So the question is this one tooth that tried to split into two, that's called gemination or twinning, or is it two totally separate teeth that decided to join together, which we call fusion? The tricky part, they can look exactly the same. So how in the world do you tell them apart? Well, the trick is brilliantly simple. You just count the teeth in the arch. Think about it. If it's gemination, it started as one tooth. So if you count that big tooth as one, your total number of teeth is going to be normal. But if it's fusion, it started as two separate teeth. So when they join up, you're going to be one tooth short in the count. And just like that, mystery solved.
Sometimes the problem isn't with the number of teeth or their shape, but with the actual building materials. We're talking genetic conditions that mess with the quality of the construction. For example, some conditions affect the enamel, others mess up the inner dentin layer. And there's this other one that creates this chalky, really weak enamel on certain teeth, which makes them super sensitive and likely to break down. You can imagine all of these structural problems mean you need some pretty intensive dental care. So, with all these different things that can happen, how do dentists piece it all together? Well, they basically become detectives or site inspectors. They have a clear, logical playbook they follow to get to the bottom of what's really going on. And knot investigation really boils down to three core steps. First, they get the story. That means a really detailed medical and family history. Second, they look. They do a super thorough clinical exam, checking everything from symmetry to spacing. And third, they get the picture, using specific x-rays to see what's happening underneath the gums. So just remember, story, look, picture. That's the workup. And when it's time to manage these situations, there's almost always a number one priority. For example, if a baby molar gets lost way too early, the top job is to save that leeway space we talked about earlier. By using a simple little device called a space maintainer, a dentist can prevent this whole domino effect of teeth shifting around, which could lead to major crowding and really complex orthodontic work down the road.
So when you think about it, every single smile tells a story. It's a unique piece of biological architecture, filled with clues about its own construction timeline and its history. And now that you've had a peek at the blueprint, maybe you can see that a smile is so much more than just a set of teeth. What will you look for now?